Module Overview. Substance abuse among youth is a multifaceted global health issue that stems from complex interactions between availability, accessibility, curiosity, misinformation, peer dynamics, trauma, and lack of guidance. Module 2 provides an in-depth classification of substances commonly misused by adolescents, their pharmacological categories, street names, routes of administration, short and long-term effects, and their legal and health implications. This module explores both licit, legal, and illicit, illegal substances, encompassing stimulants, depressants, hallucinogens, opioids, inhalants, cannabinoids, prescription drugs, and emerging synthetic or designer drugs. Special attention is given to locally available substances in African contexts, e.g., tramadol, codeine syrup, marijuana, alcohol, glue, and energy drinks laced with narcotics, as well as globally pervasive drugs like ecstasy, LSD, and crystal meth. The module incorporates evidence-based data from WHO, UNODC, CDC, and National Narcotics Commissions, and aligns with curricula guidelines of NERDC and UNESCO's life skills education, ensuring you receive a standardized, robust understanding of substance abuse patterns among young populations. Detailed classification of substances. 1. Stimulants. Examples: cocaine, methamphetamine, nicotine, caffeine, ecstasy, MDMA. Street names: ice, speed, crack. Molly effects: increased alertness, euphoria, heart rate, reduced appetite, restlessness. Risks: cardiovascular issues, psychosis, addiction, paranoia. 2. Depressants. Examples: alcohol, benzodiazepines, barbiturates. Street names: booze, downers, benzos, Valium effects. Relaxation, slowed brain activity, reduced anxiety. Risks: respiratory depression, memory loss, unconsciousness, overdose. 3. Hallucinogens. Examples: LSD, psilocybin mushrooms, DMT, PCP. Street names: acid, shrooms, angel dust. Effects: distorted perception, hallucinations, emotional swings. Risks: psychotic breaks, panic attacks, poor judgment, long-term mental disorders. 4. Opioids and narcotics. Examples: heroin, morphine, codeine, tramadol, fentanyl. Street names: brown sugar, smack, syrup, oxy, K-pain. Effects: euphoria, pain relief, sedation. Risks: addiction, overdose, respiratory failure, withdrawal syndromes. Cannabinoids. Examples: marijuana, hashish, synthetic cannabinoids, spice, K2. Street names: weed, pot, ganja. Loud effects: relaxation, altered sense of time, hunger, laughter. Risks: impaired cognition, lung damage if smoked, dependency. 6. Inhalants. Examples: glue, correction fluid, gas, petrol, aerosol sprays. Street names: huff, whippets, sniff effects, dizziness, euphoria, slurred speech, hallucinations. Risks: brain damage, sudden sniffing death syndrome, respiratory issues. 7. Prescription and over-the-counter drugs. Examples: Ritalin, Adderall, cough syrups with codeine, sleeping pills. Street names: purple drank, lean, Skittles, bars. Effects: vary depending on drug, either stimulation or sedation. Risks: misuse leads to dependency, overdose, or severe withdrawal symptoms. 8. Synthetic designer drugs. Examples: bath salts, synthetic marijuana, 2C-to-B. Street names: N-bomb, Flocka, spice effects, highly unpredictable, may mimic stimulants or hallucinogens. Risks: extreme agitation, violence, cardiac arrest, psychosis. Learning outcomes. Upon successful completion of this module, you should be able to identify the categories and examples of substances commonly abused by youth, distinguish between legal and illegal substances and explain their routes of administration, describe the pharmacological and psychological effects of each substance, recognize the health and social consequences of substance misuse. Look forward to congratulating you upon the completion of this course. See you in the modules. Forward to congratulating you upon the completion of this course. See you in the modules.